Hello, FHA members. It is hard to believe that we are nearly 6 months into 2022. And of course, it is a little better than what we experienced over 2020 and 2021, though we did start off with some pretty significant challenges with COVID early in the new year. I know we are all hoping to avoid another significant surge during the remainder of this year. Again, to all of you, I want to express on behalf of the Florida Hospital Association our deep appreciation for all that you do day in and day out. Recently, it was great to be back in person with the FHA board members at this year's Board of Trustees meeting in Orlando. It was our first board retreat in over 2 years. The collaborative discussions that took place will go far in informing the development of our association's strategic plan to, again, guide our priorities on your behalf. We will refine and clarify our actions, our programs, and we will continue to elevate the collective and unified voice of Florida's hospitals in all of our communities and especially with our legislators. Nurses Month may be over, but our appreciation for our nurses is all year long. I'm pleased to say that the advocacy efforts of FHA and its members have shed light on the growing workforce shortage crisis in Florida. We worked in Tallahassee to secure over $125 million for nursing education in Governor DeSantis's final budget this year. Yet, we all know there is much more work required to keep lawmakers aware of how critically challenging this situation is, to expand the workforce pipeline, to identify educational opportunities, to support career pathways before this workforce crisis gets worse. We know how incredibly dedicated you are to your patients. FHA is incredibly appreciative of the critical work our nurses and all our healthcare professionals do to benefit the health outcomes of all Floridians. Also, this year in the Florida state budget, it included $126 million for the expansion of behavioral health services, a top priority for the FHA. The money will be allocated to the Department of Children and Families to expand behavioral health services through Florida Assertive Community Treatment Teams, known as FACT teams, Children's Assertive Community Treatment Teams, and Family Intervention Teams. FHA has been fiercely advocating for expanding these commitments to critical community-based mental health services to ensure that people get access to treatment when they need it in the community and they are not forced to rely on the emergency department as their point of entry to the healthcare system. I and FHA are so appreciative of the hard work done by the FHA Board, the Behavioral Health Council, and our member hospitals for the guidance and support in advocating for this priority over the past year. As a membership-driven organization, FHA offers many opportunities to engage with state and federal partners, lawmakers, and other healthcare professionals. On that note, I hope you can join us this June for 2 critical webinars we are hosting together with Florida's Department of Children and Families. On June 27th, FHA and DCF will provide an overview of the anticipated end of the federal public health emergency as it pertains to Medicaid eligibility and the requirement that now over 5 million individuals in the Medicaid program have to have their eligibility re-evaluated. DCF leadership will discuss their plan for conducting the redeterminations and the approach to communications with all providers and with Medicaid enrollees. Then, on June 29th, DCF will once again join FHA to focus on Florida's behavioral health system. Those financial increases, the budget increases that I mentioned earlier, we want to hear from DCF about their plan for prioritizing that funding for behavioral health and the work of this legislatively established mental health commission. You don't want to miss these informative meetings with FHA and DCF leadership. Please visit fha.org/events or click the links below to sign up today. And last, please join us for the Florida Hospital Association annual meeting. It's scheduled in October 12th to 14th in Orlando, Florida. We are thrilled to be back together in person to discuss the latest trends driving healthcare, to talk about some of the challenges, to celebrate our success and the work of our hospitals and all caregivers over the last year. The meeting features several notable national thought leaders in the healthcare community, including Seema Verma, former Centers for Medicare and Medicaid Services Administrator, and Dr. Deborah Birx, of course, someone who was actively involved in the last administration in supporting the response to the pandemic. Of course, Dr. Birx is also a world-renowned medical expert in immunology, infectious disease, and global health. Registration is now open and the link is below this video. Sign up today. We look forward to seeing all of you there. Again, thank you to you, our members. The Florida Hospital Association is here for you, and we will continue to raise the collective, united voice of all our hospitals. Thank you.